Hi there, I'm Dr. Kristina Turkewitsch and I'm a chiropractor in Newmarket, Ontario, Canada. Now, have you noticed that your posture has started to change? Have you started to notice a bump starting to develop right at the base of your neck that wasn't there before, and just all of a sudden you noticed it one day? Do you have pain or tenderness or tightness in your neck or your shoulders or your mid-back? Well, stay tuned, because today we're going to be talking about posture, specifically head forward posture. And I'm going to be sharing with you my 3 best exercises for head forward posture. So don't forget to subscribe and click the bell icon so that you can be notified every time I post a video. Now let's get to it. I'm going to go through these exercises. I'm going to explain actually first a little bit about head forward posture, and then I'm going to go into some exercises for you. Now, what is head forward posture? Head forward posture is a posture where your head comes in front of your body. So like this, right? So unfortunately, our lives nowadays are really centered around the computer. Also texting, right, on our phones with our heads down like this, and also driving. We're all in these sedentary or somewhat sedentary positions with our body or our head being put in front of the body. Now, this is almost somewhat of an epidemic. It is a posture that I see everywhere on almost every person. And a lot, I would say 90% or more of the patients that I see in my office have this abnormal posture. So whenever you are doing an activity where you're focusing on something that's in front of you, your body wants to move in that position. And over time, the muscles, well, certain muscles will become tighter and other muscles will become weaker, because our bodies adapt to that seated position that we're in for an extended period of time. Our bodies are very smart, they're very smart machines, and they will adapt to whatever it is that you're doing most often. So if you're sitting a lot, you're going to start to slouch forward, your head's going to start to move forward, and the front of your body is going to start to tighten up, especially in the shoulders. So this is all contributing to this head forward posture that we see everywhere. The reason this posture, starts to become such a problem is because your head weighs quite a bit. So the average head can weigh between 10 to 14 pounds, sometimes maybe even a little bit more. So when you have it out in front of your body, that's a lot of stress going down through your neck, your shoulders, your mid-back. For every inch that your head moves forward, you can multiply the weight of your head by 10. And so if you've moved ahead 1, 2, 3 inches, you can only imagine how heavy that becomes. And then your body has to work a lot harder to keep your head upright. And so the muscles of the neck, the shoulders, the mid-back, the joints, the ligaments, they're all working overtime so that we can keep your head from falling to your chest. You might not necessarily notice this posture developing in its early stages. You might only one day just, look at yourself in the mirror and notice that your posture is a lot different than it used to be. And sometimes people do feel like a hunched feeling, right? So it might take, weeks, months, or years for you to notice, and your body has been developing this posture over that really long period of time. And if you, just start to massage your neck and your shoulder, your upper area here, you might notice there are knots there. You might notice pain developing in between your shoulder blades, right? And you can even start to develop headaches over time. And you notice, a headache that you would get maybe once a month now is starting to become once a week, and then almost every other day. So these are all symptoms of, or can be symptoms of, head forward posture. Not only will this posture affect the soft tissues, right? So the muscles and the ligaments, those kinds of things, but they also start to affect the spine itself and the bony parts of the spine. So like the joints of the spine, right? Which would be the facet joints. And I'll just get a spine so I can show you exactly what I'm talking about. So it starts to affect the bony parts of the spine. So things like the facet joints. And then it'll also start to affect the discs in between each vertebra as well. So this posture over time will create wear and tear in the joints, the bony parts, the discs in your neck and spine. So what this means is that over time, degeneration will start to set in and things like arthritis can start to develop. You can start having adhesions in your joints, making them sticky, and so they can't move properly as well. So we want to start to work on these things at home, and to do that, some exercises, an exercise routine for this can be quite effective. Now, I just want to say that along with exercises, doing these exercises at home, it's good to get assessed by a chiropractor, because if there are adhesions in your spine, so fixed joints, etc., things that need to be moved, a chiropractor would be best to do that so that we can move the spine, get it more flexible and more able to move, and that way these exercises will be that much more effective because you have more mobility in your spine. So here are my 3 best exercises for head forward posture. The first exercise we want to do is called chin tucks. Now this is an exercise I've demonstrated before, but it's really great because for head forward posture, when you are jutting your chin forward, so you like to go into this position, doing the opposite of that is really going to help retrain the body, okay? So with chin tucks, what you want to do is tuck your chin. I mean, it's very self-explanatory. You just want to put 2 fingers on your chin and tuck your chin back. So you're actually going to get a bit of a double chin at the front, and if you're getting a double chin, you know you're doing it right. Okay, unfortunately it doesn't look really cute, but it's definitely the best way to judge if you're doing it correctly. Okay, so tuck your chin and bring your head back, right? So you're kind of trying to almost line up your shoulder and your ear together. All right, and what that's going to do is it really helps to stretch the suboccipital muscles, which are the tiny muscles at the base of your skull that attach to the top of your spine, and they become very tight when you're sitting in this kind of a position, or even with your head down texting. They become very tight and sore, and so you want to stretch those out, right? So you want to tuck your chin. So for chin tucks, you can do 10 to 15 repetitions 2 to 3 times a day. And a great time to even do it would be sitting at a red light. So you have to sit there and wait anyway, so you might as well give it a go in your car. And it's great because you have the headrest behind you, so you just bring your head back, tuck your chin, and touch your head to the headrest. Now the second exercise I'm going to demonstrate is actually an exercise designed a little more for your upper body itself. Because when you are in a position that you're focusing forward, so driving, computer work, phone, texting, those kinds of things, your body will round forward as well. So your shoulders become rounded, your mid-back might become rounded and a little more hunched, right? And so in order to work against that and do the opposite, to bring it back, we need to do what we call scapular retraction. Now this is a big fancy word or words to describe just bringing your shoulder blades together. And you want to basically come up to the wall. You're going to roll your shoulders down and back, so you want to feel them tucked together a little bit. You're going to put your back against the wall. You can put your head against the wall, And you're gonna hold your arms in a W position like so. And you wanna touch, preferably you wanna touch your hands and your forearms and your upper arms against the wall. And you're gonna hold this position. And then you can relax, and then you can do it again and get into that position. And you actually kind of want to tuck your chin a little bit because you don't want to be doing this, you don't want to be doing this, okay? So you want to be relaxed, shoulders down, roll your shoulder blades down and back, hold them there, touch your back to the wall and your arms, bring your head down and hold it. So for this one, again, you can do 10 repetitions a couple of times a day. The last exercise I'm going to demonstrate is actually a combination of the first two, okay? So you get to work a little harder this time. And we call them wall angels. So for this, you're going to get into the position against the wall. So your bum is touching the wall, your upper back is touching the wall. You might have a little arch in your low back, that's fine. So you bring your arms to the wall in that W, right? You're gonna actually then really actively tuck that chin. So you're gonna tuck it down and bring your head to the wall. And you're actually gonna move your arms up while touching the wall, and then you're gonna bring them down, just like that. Now, depending on your level of flexibility in your upper back, your mobility in your shoulders, you might not be able to move very far, and that's okay, all right? So you're just gonna move in the range of motion that you can do. Don't push it too hard, okay? Over time, as you do this exercise, these combined exercises more regularly, you'll get more mobility and more flexibility. So for these ones, you can get into the position, move your arm up and down 3 to 5 times, and then relax, okay? For a count of 5 or 10, and then do it again. Tuck your chin, bring your shoulders back, roll them down and back, touch the wall, right? And then slide them up and down. So I would say you could do this again a couple of times a day. There you have it. Those are my 3 best exercises for head forward posture. Thank you so much for watching. I really hope you like this video. I really hope that it benefits you. And if you could please subscribe to my channel, that would be so awesome. Now don't forget to like and share this video with anyone you feel could benefit. And of course, leave a comment for me and let me know how it goes for you, or if you have any other questions or comments. Thank you again so much for watching, and I'm gonna see you on the next video. Bye!